Hey everyone, today we are going to talk about getting an IV on a patient on isolation, specifically a COVID-19 patient. When I go into the room, I want to make sure that I have all of my supplies. I know exactly what I need. I know what size gauge I need. I have all the supplies with me. I know if he needs blood work or she needs blood work. The number one thing that I suggest doing to make yourself more comfortable is taking off the stethoscope, putting it down. If you have badges, take them off. You're going to start by taking the patient's hand and bringing it around to the side of their bed. Couple key things. If the patient is able to turn their head and look the opposite way as you, have them do that. That way, if they do cough, they won't be coughing in front of themselves and getting closer to you. The next thing you want to do is elevate their feet. Yes, elevate their feet. Why? When you elevate the patient's feet, it increases blood return back to their upper extremities. These patients are already dehydrated. Have the time and they're not super critical when you first get them. Go get some heat, put on some warm packs, make some with gloves, and do what you can to increase blood return to that area. Next thing you want to do is elevate their bed all the way up. Bring it all the way up in the air, as high as it can go. Dangle their arm off the side of the bed. Having their head all the way turned to the side and their arm dangling up on the side of the bed, their feet elevated. What the goal is that you're taking all of the blood that they have in their body and shunting it to whatever limb it is that you're looking on. It's going to make it way easier for you. Once you have that all happening, you're going to always use 2 tourniquets, okay? Double tourniquet this for sure. Make sure it's on tight enough. Then clean it, get it ready to go. For some people, these goggles can cause some glare. I know for me, I'm seeing some glares right now. The best thing to do to avoid this is to use this like a clicker pen, and you would draw a circle on the vein that you find like this. Just takes like maybe 30 seconds. You don't have to actually do it that hard, but it appears pretty easily. That way, you know exactly where you're gonna go. So you feel the vein, you're like, okay, this is where I'm gonna go. You feel it, and without moving or going back to what you're doing, make the circle. This dot will stay on there for like at least 60 seconds or so. These little things, you guys, they all matter.